Hi, my name is Michal Klau-Stevens, and today I'm talking about the book Expecting Better: Why the Conventional Pregnancy Wisdom is Wrong and What You Really Need to Know by Emily Oster. And this book is stirring up quite a controversy. What she's talking about are the questions that a lot of pregnant women have. How much wine can I drink when I'm pregnant? How many cups of coffee can I have a day? Can I eat cold cuts? What should I do about prenatal testing? Can I garden? What about amniocentesis? These are questions that a lot of pregnant women have, and the author of this book has gone through the scientific evidence and stated, what does the evidence say? She's also posited the framework of how do you make decisions during pregnancy, or how do you make decisions about anything. And the framework basically is you look at the evidence, what does the evidence say, and then what are the risks and benefits to you as an individual. And you make your decision based on those things. Well, a lot of people are upset because here's a book that's talking about pregnancy wisdom, but it's not written by a doctor. It's written by an economist. And Ms. Oster is an economist. She's a professor of economics, and as a pregnant woman, she utilized her tools as an economist to go through the scientific evidence that relates to pregnancy, and that's what she publishes in this book. And a lot of people are upset about it because they say, what is an economist doing talking about pregnancy and giving advice to pregnant women? And the controversy, in my mind, then, focuses not on the information that she's giving in the book, which is about the same as what you would find in your typical women's magazine article on pregnancy. But the controversy is really about who's entitled to special knowledge and who has authority. A lot of times we think that doctors have special knowledge, that they're the only ones who are allowed to speak on medical questions. But what Ms. Oster is questioning is that medical knowledge special knowledge to medicine, or is it something that's readily available and out here for everybody to utilize? And in today's age, with all the information that we have on the internet, the concept of special knowledge is really diminished because there are lots of intelligent women who are well educated and well informed, who are able to crunch the numbers the same way that medical people can crunch the numbers and make decisions based on what they find. So really what's a controversy here is who has access to special knowledge and who's allowed to use it. The other thing that is controversial is who has authority. Should doctors be the only people to make decisions about what happens to their patients, or should patients be allowed to make decisions based on what their needs are? And it's recognizing the authority of the patient as being an expert about themselves, being an expert about what their needs, their values, what their desires are. And what this comes down to is really a shared decision-making philosophy, which is not readily accepted yet in our society. There are still a lot of people who feel that doctor knows best, you just do what the doctor says. But that is in tension with an incoming belief that patients should be able to have say about what happens to them. So the controversy really is about special knowledge and it's about authority. And Ms. Oster kind of stepped into it because, she's as somebody who's outside the medical profession and as a woman, a pregnant woman, what people are saying is that she doesn't have the special knowledge and she shouldn't have the authority. And that's not necessarily true. I think that we're in the 21st century, and there are a lot of intelligent, well-educated women who are pregnant and will become pregnant, who want to have the best information about pregnancy so that they can make decisions about their own bodies. And I think that the caregivers who are able to incorporate shared decision making, sharing that special knowledge, sharing authority with their patients, are the ones who are going to be best able to handle this new kind of patient. So I think that Ms. Oster is pretty cutting edge in what she's doing, that she's asserting herself as a woman, as an intelligent woman who is able to crunch the numbers and able to have intelligent conversations about her care, and she's sharing her experience with others. So that's what the controversy is about, and if you believe that you have authority over what happens over your body, and that you are able to learn and incorporate this special knowledge, I sincerely encourage you to go and seek it out, and seek out care providers who are able to meet you as a partner in your care.